This video shows an example of a patient who was not only unhappy due to her crooked nose, but was also suffering from breathing difficulty. Watch this video till end and subscribe our channel for new videos.
Every case of rhinoplasty is different. In her case, there was significant nasal deviation. So nasal deviation is due to the underlying septum. So there is a deviated nasal septum. So we do septoplasty, and there is a bulbous nasal tip. We want to do the nasal tip modification also. From the side view, you can see there is a significant nasal hump. The height of the nose is more, both the bone and the cartilage. Similarly, from the profile view, you can clearly see the hump and the droopy nasal tip. So we are planning for open rhinoplasty, in which we are doing preservation rhinoplasty with minimum degloving that reduces the downtime, reduces the swelling. So we open the nose and we use special bone rasping instruments to decrease the height of the nose and the cartilage. After that, we do the nasal tip modification, and we do the septal correction, and in the end we also do the osteotomies. So this all is achieved within few hours and your nose is transformed.
In some cases of rhinoplasty, a splint is placed on the nose for protection and healing of nasal bones. The splint is removed after few days and patient sees her new nose.
Wow. There was significant hump which has been corrected, and there was a nasal deviation. So we have corrected the deviation. You can see the nose is very straight, and there is some pinch defect due to the splint, and there is some swelling at the nasal tip. So the final result, the swelling will reduce. Do you want to see your nose?
Yes, of course. Wow, so good, doctor.
The patient's satisfaction and happiness is a reward for our doctors and whole team of Kyra Aesthetic Clinic.
So I would like to show you the result of the same patient. So from the profile view, you can see the dorsal is slightly curved and straight. Earlier there was a significant hump. From the front view, you can see the nose bridge has been brought to the center due to the DNS. So we have done the surgery to make the nose appear straight. Earlier it was deviated. You can also see the nasal tip which has been lifted up. So there was a droopy nasal tip, and in the females we want to give a slight curve to the dorsum of the nose.
A deviated nasal septum is displacement of wall between nasal passage to one side. It can partially block the airflow through the nose and it causes difficulty in breathing.
रेनोप्लास्टी से पहले मेरे को सांस लेने में बहुत दिक्कत आती थी। डॉक्टर ने बताया था कि मेरे नोज़ के अंदर जो सेप्टम है वो टेढ़ी थी, उसकी वजह से मेरे को आई थिंक कि सांस में प्रॉब्लम आती थी। बट नाउ सर्जरी के बाद आई फील रिलैक्स्ड कि मेरे को बिल्कुल भी दिक्कत नहीं आती है। ऑल थैंक्स टू डॉक्टर गावरी। थैंक यू सो मच डॉक्टर।
So we have done rhinoplasty for her 1 month back. So she has come for the follow-up after 1 month. So you can see a straight nose. Earlier she has a deviated nose, so we have done septoplasty. And on the profile view, again you can see a dorsum which has been nicely reduced in height. She had a significant dorsal hump. In the dorsal hump surgery, we have to reduce the bone and the cartilage, and we have to do the osteotomies to bring the bones together. Then we have done the nasal tip modification, alar trim, and from inside we do the DNS correction called the septoplasty. So you can see there is no sign of any mark of the surgery, and her skin is easily movable with 100% sensation. So we always believe these days in the preservation rhinoplasty, in which we respect the tissues, so the healing is very fast.
The crooked nose, which was an unattractive feature of her face, was transformed into a symbol of beauty.
पहले तो मैं बहुत ज़्यादा डिप्रेस रहती थी अपनी फेस को देख के, पर अब इतना कॉन्फिडेंस हो चुका है फेस पे, कोई भी किसी से भी बात करने से पहले इतना कॉन्फिडेंस आ चुका है कि अब कोई डर नहीं कि कैसा लग रहा है मेरा फेस, कैसा नहीं लग रहा। और थैंक्स टू डॉक्टर गावड़ी।